Welcome to Blackwood Vascular, a YouTube channel where I educate patients in real layman's terms about normal things that a vascular surgeon sees every day. I'm hoping to just simply make things very simple for people to understand, showing you guys pictures of things that we go through every day as vascular surgeons. And if you like these videos, remember this is all medical education. There's no advice here. If you want advice, go see your own doctor. But like and subscribe and follow along if you like these videos. And if you have a question or email me at blackwoodvascular@gmail.com and I can make a video for you. Hello everyone, Dr. Stuart Blackwood here from Blackwood Vascular. Today I want to tackle a question that came up, which was what exactly caused this patient's toes to turn black? And just as importantly, another question is it always diabetes and vascular disease and smoking, or is it sometimes just other things that are normal and common in the person's life? And for the medical students, you have to be sort of like a Sherlock Holmes to figure out these ones. But not everything will be found in a textbook. So again, this is all educational. This is not medical advice. Just talk to your own doctor if you have anything specific in your own situation that you want advice about. So why does this all matter? A lot of people, honestly, a lot of clinicians see black toes and early gangrene and immediately assume that it's diabetes or blocked arteries. But that is not always true. And sometimes the real cause actually is mechanical or environmental or related to workplace gear or just the habits that people don't even think about when they're going through their day-to-day busy lives. This patient was a factory worker working with caustic chemicals, and he's told by the workplace, which is correct, to wear tall, rigid boots with steel toes and keep chemicals from getting inside the boot. So in order to do that, one of the things that he has done as a workaround is that he has pushed his pants legs down and socks into the boots since he started his job. And it's kind of a safety move. But the problem is mechanically, it is causing a perfect setup for a toe injury. He stuffs the fabric into the tight boot. The fabric of the pants fall down over his socks into the actual beneath his heel. And in order to pull the socks and the pants out while he's at the busy workplace, he grabs the sock and the pants together and he pulls both of them up. Eventually he gets the pants leg partially out, but every single time he's pulling on the sock tighter and tighter. This ultimately creates a shear force on his nails and skin, and add moisture, heat, a long shift, repetitive pressure every single day. And over time, over a period of 6 months when he was working, he developed blistering and bruising tissue injury that ultimately looked black or purple. So I guess another question that comes to mind immediately is this diabetic or vascular disease? And if someone has diabetes or microvascular disease from diabetes and their circulation isn't as strong, does it mean that it was the diabetes that caused this to happen? Or was it the repetitive pressure plus the diabetes? Or was it the repetitive pressure alone? Who is to blame? And, if you, let's say you had a person with a skin condition that couldn't be exposed to sunlight, but when they take a job, they're told to work by the poolside with no umbrella. Well, does that qualify for workman's comp if they're forced against their skin conditions to go out, or if they're told to do it? Whether the company knew it or not. But the reality is that I don't know, and I think this is the reason I'm posting this video. Partially is because from my end, the gentleman I think has been denied for workers' comp because of diabetic microvascular disease. But I don't think that diabetic microvascular disease is the only problem here. I think repetitive pressure, shear forces, tight PPE, his shoes that he's wearing, big boots which are not like these big plastic water boots that have a steel toe in them, not flexible, moisture, maceration, nail bed trauma, and there's just repetitive subtle crush injuries have led to this. So I guess the real question for me is, did the workplace injury happened because of the boots and the PPE or the chemical environment that he had to do, in this caustic liquids that he was pushing his pants into. Did diabetes just tilt the scales, or was diabetes the whole problem to begin with? I think given the fact that he had multiple jobs before that, and he never had black toes before that, I would argue probably more likely that it's a combination of both. I went by, I saw him, beautiful palpable pulses all throughout. I immediately knew that this was not a macrovascular problem. His dorsalis pedis and his posterior tibial are both palpable easily on top of the foot. And just the pattern of the pressure on this younger patient suggested to me that this was not a diabetic issue. This patient is not even on insulin at this point. He does have some neuropathy, even though he doesn't realize it, but he does have some. And clearly he does, because nobody would be able to tolerate that kind of pain for that long unless he's the most committed factory worker ever. So next time you guys see black toes, don't jump straight to diabetes or vascular disease. Ask actually what happened to the foot. Ask about the boots, the socks, the environment, repetitive motions. Think about, diabetes is just part of the one of the actors, kind of the person who sets up the stage. But the workplace and the mechanics and pulling on these socks actually is what pulled the trigger and caused these wounds to happen. Again, this is all just my opinion for educational purposes. It is not medical advice. If you're dealing with something like this, talk to your own doctor. If you want more breakdowns like this, subscribe to Blackwood Vascular channel. It's 100% free, and it's focused on helping you understand your vascular health. Good luck.